My name is Dr. Damon Daniels with the Blackwell YouTube station. Just a little bit of background on myself. I'm a board certified family physician with over 20 years of experience in both the academic and private practice setting. And more importantly than that, I have a passion for helping patients to stay healthy. So over the years, I've done quite a bit of study on lifestyle changes and its impact on health, as well as a variety of different herbal products that can help individuals to live healthier and happier lives. And so our topic today is conquering cancer. Again, conquering cancer. Oftentimes when patients get a diagnosis of cancer or concerned that they may have cancer, it can be a frightening situation. And unfortunately, in the United States of America, cancer is very common. In fact, in 2025, it's estimated that approximately 2 million Americans receive the diagnosis of some type of cancer, and about 600,000 of those individuals will actually die from whatever cancer that they're dealing with. The most common types of cancer, particularly in the U.S., are breast, prostate, lung, and colon cancer. Now, cancer is common in both women and men. In fact, in men, and check this out, 1 in 3 men, 33%, regardless of race, living in the United States will have some type of cancer during their lifetime. In addition, 20% of men, black or white or Asian, whatever their nationality may be, will die from some form of cancer. What's even more shocking or concerning is that there's something called a racial disparity in terms of death related to certain cancers. As a matter of fact, black men are more likely to die from colon, prostate, and stomach cancer. And so African American men are at a higher rate of dying from these various cancers. And there's various reasons why, and we'll talk a little bit more about it in my presentation. But this is definitely something that affects the African American community, which is why I'm passionate about sharing this with you all today. So, what causes cancer? And the bottom line answer to that is very complicated. And the causes of many cancers are not clearly understood. But we believe there's genetic factors, in other words, genes that are passed down from mom and dad generations prior that may put you at more of a risk of developing certain types of cancers. There's environmental factors. So we know that exposure to certain environmental things over time can lead to cancer. For instance, if you're one of those sun lovers and like to sunbathe, you're out in the sun all the time, well, those individuals may be at higher risk for getting skin cancer. Or I've had in my practice individuals that have worked, say, in a plant where they were exposed to certain chemicals in that plant, and over many years they developed certain type of cancers that are linked to those particular chemicals. The other thing is lifestyle. Lifestyle plays a very big role in someone's risk of developing cancer. So for instance, did you know if you ate a lot of red meat, processed meat for many, many years, you're actually at a higher risk for developing colon cancer? Or another one that we all know about or are familiar with is smoking. Smoking does increase the risk significantly of the development of developing lung cancer. But check this out. And this is what's really key in understanding cancer. 40% of all cancers are felt to be preventable. What that means is that you, through your lifestyle, can reduce your risk of even developing cancer at all, or at a minimum, trying to mitigate your risk of it, even if you have a family history of it, or maybe some environmental exposures. There's all kinds of things that are out there that we may be exposed to we're not even aware of. So many of them are preventable. Now I live in the great state of South Carolina. Uh, and one of the cancers that's very common in my area is prostate cancer. It is the second most common cause of cancer death among men in South Carolina. And in my state, there's a significant racial disparity of prostate cancer. As a matter of fact, African American men are 3 times more likely to have died from prostate cancer than other racial groups in my state. As a matter of fact, African American men, now check this out, in my state have the 3rd highest rates of prostate cancer in the entire country as of a couple of years ago. And we rank in the top 10 of prostate cancer cases in the entire world. So I don't know if there's something in the water down here, or obviously genetics may play a role as well, but it's a very, very common cancer. So, risk factors for cancer. There's various risk factors. One is age. So, the older you are, the more likely that you could develop a cancer. Okay, specifically prostate cancer. As I mentioned before, if you're African American, your risk of prostate cancer goes up. Family history and genetics play a role. Also, this is one that's really fascinating. Individuals who eat a large amount of red meat, bacon, hot dogs, and cold cuts are also at a higher risk for prostate cancer development. Or if you're one of those guys that are a grill king, like to get out there and grill food, well, eating a lot of grilled foods actually increases your prostate cancer risk as well. So, some other common cancers, as I mentioned, are colon cancer, particularly in men. It's the 3rd most common cause of cancer, specifically in those living in the South. And check this out, the mortality rate for African American men specifically is 58% higher than with other racial groups. So what are some risk factors for the development of colon cancer? 1, a diet low in fruits and vegetables increases the risk of colon cancer. A diet high in fat and processed meats. Physical inactivity, in other words, if you're not very physically active, you're not exercising, it increases your risk. Obesity, alcohol consumption, smoking, a family history of colon cancer or polyps does increase your risk. And also if you have a history of inflammatory bowel disease, that's a chronic condition where the lining of the colon is inflamed. It's an immune system issue, and individuals who have that can develop more colon polyps as well as develop colon cancer. As I mentioned, there is a disparity of cancer in men, in lung cancer, in prostate cancer, and in colon cancer as well. Something that's really fascinating is that there's also regional differences in the development of certain types of cancer. As a matter of fact, many of you are familiar with Chadwick Boseman, actually from South Carolina, from Anderson County. He unfortunately passed away from colon cancer at a very young age. I believe he was in his probably late 40s. And he actually grew up in a county, Anderson County, that's one of the hot spots for the development of cancer in the U.S. So pretty much several counties in South Carolina, some in North Carolina, and Eastern Virginia are at the highest risk in terms of the development for early colon cancer. which is basically colon cancer that develops earlier than, say, around 45. There are cases that are growing of early colon cancer, especially in those hot spots that I mentioned. Again, we don't really know why. We think it's obviously maybe environment, lifestyle. I'm sure genetics plays a role. But again, early colon cancer hotspots do exist in the United States. So, how do we manage cancer? And one of the most important keys to managing a variety of cancers, especially prostate and colon cancer, is screening. I can't tell you how often when I'm talking to some of my male patients, especially, and when I say, "Hey, man, we gotta do your your prostate cancer screening." The first thing they're concerned about is, "Oh, are you gonna stick a finger in my bottom, doc? I wasn't expecting that." And I've even had a few guys who avoid me because of fear about that, or they're concerned about doing the prep for colon cancer. But this is the reality. Screening saves lives. Screening saves lives. I remember several years ago, I had a patient of mine that to this day, I'm still taking care of him. He was avoiding coming to the doctor. Finally, his wife pretty much said, "Hey," gave him an ultimatum, "You need to go to the doctor." Hadn't had a physical in over 10 years. And so saw him for his physical. We did a stool test on him. He had some blood in his stool. Turns out we immediately got him in for a colonoscopy, and he had a large lesion on his colon. Fortunately, it was removed. Everything's okay. And again, 10 years later, he's still coming to see me, doing well. But oftentimes when I think about a patient like that, I always think about, hey, what if he never came to me and he was walking around with this cancer in his colon? And unfortunately, I've had patients who have refused to be screened, delayed their screening, and developed cancer, colon cancer specifically, and passed away from it. So screening, really, really important. So I'm going to go over some of the most current recommendations on screening. Prostate cancer screening is kind of tricky, right? Because there's a lot of differences in what governing bodies say about screening for prostate cancer. So I'm going to go over the current American Cancer Society guidelines, which recommends that men have the chance to make an informed decision with their healthcare provider about whether to be screened for prostate cancer. And you may say, "Hey, doc, you just said it's important to get screened, and now you're telling me that it's something that I may have an option to do or not to do." What it's basically saying is this: when it comes to prostate cancer, no cancer is good. But the one fortunate thing or not about prostate cancer is that it tends to be very slow growing, and that most men will die with some form of prostate cancer rather than from prostate cancer. In other words, there may be something else that they die of and have subclinical. In other words, prostate cancer is not picked up or doesn't have an impact on their overall health. Because of that, the ACS determines that it's good for the physician to talk with their patient and decide on what is their risk. Is it a good idea for them to be screened? So, for example, in my community, the vast majority of my male patients over the age of 40, I will have a conversation with them about prostate cancer screening, and the vast majority of them will be screened for it because, as I mentioned before, in South Carolina, we have high rates of prostate cancer, especially among African American men, and we live in a state that is considered a higher risk for the development of it, especially in men of color. And so I'm much more aggressive with screening and having these conversations as opposed to maybe someone else in a different part of the country. In general, if it is decided that a man elects for prostate cancer screening, there are certain guidelines that are helpful. So at age 50, for men who are at an average risk of prostate cancer and are expected to live at least 10 or more years, you can start screening at age 50. At age 45, again, this is a different group of men. At age 45, for men at high risk for developing prostate cancer, that you can start screening them then. This includes African Americans, men who have a first degree relative. In other words, if your dad had prostate cancer or your brother had prostate cancer, you're at higher risk. As a matter of fact, I saw a patient a few weeks ago with 6 family members that have developed prostate cancer. So, of course, with him, I'm like, hey, man, you need to get screened. And so we are already starting to screen him every year just because it runs in his family. Also, if you have family members that were diagnosed with prostate cancer at an early age, that does increase your risk. At age 40, for men at even higher risk. So that is those individuals with one first degree relative, meaning father or brother, who had prostate cancer at an early age. So again, maybe you're in one of those hot spots. I don't know, you live in Eastern Virginia, and that's an area where prostate cancer's hot spot where people develop it. Then you may need to get screened earlier. Or the bottom line is, if your dad was, say, 42 and was diagnosed with prostate cancer, or maybe even 50 and diagnosed with prostate cancer, that's early, so you need to be screened earlier. But the bottom line is, talk to your doctor about it. If you feel you're at risk, have a good conversation and decide on whether you should get screened or not. Now, if a person elects to get screened and the test is negative, meaning a PSA blood test, that is the primary test that we use now. It's called the prostate specific antigen test. It's a blood test. Again, guys, don't get so tied up about the finger. That is a part of screening, but if you say, hey, I don't want to do that, it's called the prostate specific antigen blood test. Men who choose to be tested, who have a PSA of less than 2.5, may only need to be screened or retested every 2 years. So you get the test done, and say your test is at 1. You may say, hey, I don't need to do this every year. We do it every other year. Screening should be done yearly for those men whose PSA level is 2.5 nanograms per milliliter or higher. Okay. But the bottom line is, you need to get screened. And guys, what's really, really important is not to fear getting screened. I remember years ago as a resident physician, I was asked to do some prostate cancer screening. It was at a local church here, and they had the guys lined up. They put me in this small room with no windows in it. And I walked in, introduced myself to the guys, and all of them just looked at me like, oh my God, here he comes. A couple of them sort of grunted like, oh man, here we go. So I set up things in the room, and we did the PSA testing, but I also had to actually do the rectal exam as well. So one by one, they're sending the guys in. I do the exam. And then towards the end, this guy came through the door. He literally filled the door as he came in. 6'5", 350 pounds, looked like a defensive lineman in the NFL. Walks in, I shake his hand, and all of a sudden he's just staring at me, looking at me, kind of just, staring at my hands, kind of a little light sweat. And I'm like, wow. So, I was trying to relax him and say, hey, it's going to be okay. I said, well, hey, brother, what's going on, man? He goes, oh, doc, I'm just taking a look at you, trying to check out how big your fingers are. And then we started laughing. I said, man, you're concerned about getting checked. I need to be concerned. I could lose my hand trying to check you as big as you are. And then we busted out laughing. I checked him and he was fine. Everything worked out good. The bottom line is do not fear prostate cancer screening. It could save your life. All right, let's move along to colon cancer screening. All right, American Cancer Society recommends that people at average risk of colorectal cancer start regular screening at age 45. This is actually a change. Many years ago, it was at age 50. They have changed those guidelines to age 45 because, as I mentioned before, with those hot spots, colon cancer is starting to appear much earlier in the U.S. population, and so it's changed to age 45, okay? There's various different tests that can be done that I'm going to go over that are sensitive for trying to pick up and screen colon cancer. All right. Again, here's the recommendations. People who are in good health with a life expectancy of more than 10 years should begin cancer screening every 10 years up through age 75. Okay. For people who are ages 76 to 85, then that's a decision that needs to be made on a person's preference, their life expectancy, what happened with previous screenings. So that's a conversation that you definitely need to have with your doctor. I've had a few patients that had polyps that developed at age 74. And that individual, I may say, hey, 5 more years, we may need to get you screened again. So it really depends on the individual. For people over 85, it's generally recommended that they no longer need to get colorectal cancer screening because the likelihood of them developing polyps that could be life-threatening is very low. So again, for screening, people who are considered to be at average risk. You're considered to be at average risk if you don't have a personal history of colorectal cancer or certain kind of polyps. There's different kind of polyps that you can have. Some of them can turn into cancer, are more likely to turn into cancer. Some of them aren't. So it really depends on what your previous history is. Again, a family history. Okay. If you don't have a family history of colon cancer versus if you do, can determine whether you're average risk. If you have a history of inflammatory bowel disease, all right, that puts you at a higher risk. So if you don't have that, you're at average. If you have a suspected polyp syndrome, and these are real rare. Okay, one's called Lynch syndrome, another one's called familial adenomatous polyposis. All that means is that if you're one of those individuals who gets a ton of polyps or have a family history of that, then you are not at average risk. I remember earlier in my career, I actually treated an individual who at age 25 developed multiple polyps, but it actually ran in his family because of this syndrome. And if you have a personal history of radiation to the belly or the pelvic area to treat a prior cancer, that increases your risk as well. So if all of those things are negative, you're considered average risk. All right, so some of the tests that are out there, there's a variety of them that are out there. There's stool-based tests. One is called the fecal immunochemical test or FIT test, right? There's also one that's out that's called a multi-targeted stool DNA test. What does that mean, Doc? That means it looks for DNA in your stool that may suggest that you have polyps, all right? That's a test that can be done. The main company out there that promotes this, and you guys have seen commercials on it, is called Cologuard. Again, that's Cologuard. What happens is they ship a kit out to you. There's instructions in there to give them a stool specimen. You send it back. It's evaluated, and then they give the results to your doctor. And then based on those stool tests, then you discuss what the next steps need to be. If it's a positive test, you still have to go on to get a colonoscopy because this test does not allow you to visually look at the actual colon. Okay. The most common one that we hear about is what's called the colonoscopy, which is done in general every 10 years. But again, if someone has polyps, it may be every 5 years. Depending on the type of polyp, that may be pushed up. But in general, for most people, every 10 years. If you have a polyp, they may push it up to every 5 years. There's also something called a CT colonography. That's what's called a virtual colonoscopy. Not real common in most communities, and those can be done every 5 years. But the bottom line is you got to get a stool test or get the colonoscopy. Now, for this session, I wanted to focus on prostate and colon cancer just because they're so common and because they affect men, and particularly African-American men have a significant disparity in terms of development of prostate and colon cancer as well as death from it. However, this is what's real important. Early diagnosis is the key to get the best outcome. That's why, guys, you got to get tested. That's why, ladies, encourage your significant other, get tested. For instance, if you have colon cancer and it's caught in stage 1, that has about a 92% survival rate at 5 years. But if you have stage 4, which is where the Bozeman was diagnosed, I believe it was stage 3 or 4, survival rate at 5 years is 15%. So again, the earlier you catch it, the better your survival rate. Same thing for prostate cancer. Prostate cancer has a very high survival rate when it's caught at early stages. 98% of men will survive at 5 years out if it's caught early. Whereas if they have stage 4, meaning it's gone outside the prostate and maybe in other parts of the body, the survival rate drops down significantly to only 30%. So the bottom line, as I said, early diagnosis is the key for the best outcome in treatment. Guys, ladies, there's a lot of treatment options out there for prostate cancer. There's prostate surgery, there's radiation therapy, there's something called brachytherapy, hormonal therapy. I'm not going to go into a lot of details, but the bottom line is try to get screened regularly. If you get early diagnosis, most likely you will be referred to a urologist and or oncologist to help walk you through what your different treatment options are. But the bottom line is it is highly, highly, highly treatable if caught early. Same thing with colon cancer. Pretty much the main two options are surgery, depending on where the lesion is, how large it is, and then chemotherapy. There's a lot of advances in chemotherapy and immunotherapy with colon cancer. But again, early identification is key. All right, let's move on to the part that I really want to drive home that I'm excited about, because I'm all about prevention, right? We want to get screened. We want to know about our risk. But what's most important is to prevent getting colon, prostate cancer, breast cancer, lung cancer in the first place. That's what's really key. If we can prevent it, and again, remember I told you 40% of cancers are preventable, which means there's things you can do in your lifestyle to prevent certain cancers. Growing research is showing that there's several lifestyle changes that a person can take to reduce the risk of cancer and or slow its progression. And so I always like to think about what I call the cancer prevention toolbox, right? The cancer prevention toolbox. So what do you need to have in your toolbox? What do you need to have in your bag to try to prevent or reduce your risk of developing cancer? Well, it's all about something called chemoprevention. That's a fancy word, but what it basically means is there are certain lifestyle factors, things you can do in your lifestyle, particularly in how we eat, how we live, that kill cancer cells, that slow down the development of cancer cells, that boost your body's ability to repair itself. So see, I believe we're so designed that our body not naturally repairs itself. And there's a ton of research that looks at that. So for instance, take a colon cancer, for example. Colon cancer is basically a cancer that develops in the lining of the colon, all right? And over time, this can happen over years. A particular cell may develop an issue with not being normal. And that normal lining has a few cells in it that's abnormal. And then over time, those abnormal cells grow and they develop what's called a benign tumor. All right. And then some of those tumors may actually have cells in it that we call malignant. In other words, they have the ability to spread. And then as things progress, those cancers can develop into what's called an invasive tumor. That tumor can go to other parts of the body. Say if you have colon cancer, then it now goes to your liver, other parts of your body, which destroys the liver tissue. And then over time, as it invades different parts of the body, it can then become deadly and an individual can die from that particular cancer. What we want to do with chemo prevention is do and initiate some lifestyle changes early in that process so that we hopefully equip our body to be empowered to repair itself. All right, so the cancer prevention toolbox. What's important in your cancer prevention toolbox for not only prostate and colon cancer, which I've been focusing on, but really a variety of cancers? First, number one, increase the amounts of fruits and vegetables in your diet. Mom was right when she was saying eat your fruits and vegetables. There are a variety of fruits and vegetables that are full and packed with cancer fighting properties. For example, berries, blueberries, strawberries are full of cancer fighting properties. As a matter of fact, if there's one berry that would say, hey, take it every day, take a handful of this every day, it would be blueberries. It's good in terms of cancer fighting properties. It's good for brain health. There's some animal studies out there looking at combination therapies in animals with blueberries and strawberry preparations. But fruits and vegetables are really, really important in terms of chemo prevention. The more fruit and plant-based you eat, the less likely you to develop certain types of cancers. Physical activity. So the other thing in your cancer prevention toolbox that you want is to increase the amount of physical activity in your lifestyle, right? You got to get moving. The more you move, the less risk you have for cancers. And the way to think about it is when you're physically active, it naturally just helps your body release those carcinogens or toxins. Again, carcinogens are cancer-causing chemicals or properties. It's a natural flushing system. It cleanses the body when you are physically active. So that's number two that you want to have in your cancer prevention toolbox. Number three, maintain regular intake of green tea or green tea extract. And guys, I'm not talking about, ladies, I'm not talking about Lipton green tea. That's full of sugar. I'm talking about real green tea that you brew or green tea extract. It has something called cachectins in it. Cachectins that have cancer-fighting properties in the test tube. In the test tube, meaning that scientists have looked at what green tea can do to cancer cells, and it tends to slow down the progression of that. So if you're a tea person, drink green tea. You have to drink a good bit of it. It has to be a regular part of what you do. Green tea daily makes a huge difference. Number four in the cancer prevention toolbox, increase the intake of what we call cruciferous vegetables. That's your broccoli. That's your cauliflower. those particular vegetables are power packed with cancer fighting properties. So if you're a broccoli person, include it in your diet. Of course, the way you prepare it makes a difference. You don't want to overcook it because it loses some of its healing properties. But as many cruciferous vegetables as you can do, include it in your diet. Number 5, increase what's called quercetin levels in your diet. Now, what does that mean? Quercetin. I know you guys have probably heard the term, an apple a day keeps what? Me away. An apple a day keeps the doctor away. Part of the reason that is in the lining of apples, there's a chemical in the skin of apples called quercetin that actually has cancer prevention properties as it's been studied in the test tube. So eating that apple a day has some important qualities. And it's also good for your cardiovascular health, your heart health as well. So again, put in your toolbox in terms of prevention, fruits and vegetables, physical activity, regular intake of green tea, increase your intake of cruciferous vegetables, broccoli, cauliflower, and increase quercetin levels in your diet, which the easy way to do that is an apple with the skin, Now we're going to move on to some herbals that are out there that have some research behind it that suggests it has cancer preventing properties. One that I highly, highly recommend is called Juice Plus. You can Google it. I'm actually a distributor in my office of Juice Plus. They have a orchard blend, a garden blend. They actually have a berry blend that's out as well. There's a wealth of clinical studies on Juice Plus. If you Google it and look it up, you'll be really fascinated on some of the research as applies to not only cancer, but cardiovascular health as well. So I'm real big into this. Part of the reason why is they have gummies that they make, and you can do, I think it's 4 gummies of each one per day, and or they actually have a powder as well. They also have capsules, but it's something that you can add to those other things in the toolbox that I mentioned. So again, the foundation is the plant-based diet, but these are things that you can add on. So check Juice Plus out. I think it may even be available on Amazon now. I'm not really sure, but just Google it and research it on your own. But I suggest you add it to your lifestyle. Right. 2 herbals that I want to talk about that have some cancer fighting properties. One is a product called curcumin, Curcumin. Curcumin. Curcumin has a variety of studies in the test tube, in animal studies, looking at its ability to slow down the progression of cancer cells. And curcumin in the test tube appears to do this for a variety of cancers: colon, breast, lung, prostate. And so I'm a real big proponent of adding curcumin to your herbal toolbox. A product that is very, very good is called Thorn, curcumin by Thorn. You take 2 capsules daily. Thorn has been used in a lot of clinical studies. It's a very great company that makes quality herbals. And I bring up the specific names because not all herbal products are the same. And that's why it's really important for you to make sure that you take a product that actually has some sort of therapeutic effect. In other words, it helps your body fight off certain diseases. It is an add-on to treatment. So it is not a treatment for any cancer at all. It simply supports your body's ability to fight off illness. So again, curcumin by Thorn Research, 2 capsules daily. And then the last one here is called resveratrol, Resveratrol, resveratrol. Resveratrol comes from grapes, red grapes. If you live over in Europe, where they have all those good varieties of wines, in the Mediterranean area, where that's a part of their lifestyle, they tend to have lower rates of certain types of diseases because of a chemical, or several chemicals, but one is resveratrol, that is naturally grown and comes from grapes. The challenge with resveratrol is that it is quickly processed in the body, so you have to have the right therapeutic dose of it. So a very high quality product is one called Tonic resveratrol, Toniic resveratrol. Google it, look it up. It's 2 capsules daily. So again, the resveratrol and the curcumin are something that you can add to your cancer prevention toolbox to live a healthier life. Well, that's it, folks. Thanks for attending this session of Blackwell. Hopefully this information is something that can empower you to live a healthier and happier life. God bless. Have a good